Okay, I'm ready now.
Right. Both ready? All right. If you've read and understood, considering it history taking station, please begin.
Okay, hello.
Hi, doctor.
My name is Asif Hassan. I'm one of the surgical team. Can I confirm your name and age, please?
Yeah, my name is Sarah and I'm 68 years old.
Nice to meet you, Miss Sarah. Today you are here because of your hip surgery, right?
Yeah, doctor, I'm in severe pain. I cannot bear it anymore.
I'm so sorry for that, Miss Sarah. Is there anything I can do to help you? Give you a painkiller, maybe?
No, I'm okay.
Okay, I'm going to ask you some questions to assess your fitness before the surgery. Okay?
Okay.
Okay. You said the pain is increasing. I just wanna know, is it from score from 0 to 10? From 1 to 10 score, 1 being the lowest and 10 being the highest. Can you tell me how severe it is?
Yeah, when I move, either take few steps or try to go
Mm.
upstairs, I would rate it at 10. Yes.
Oh, that must be really frustrating. I'm so sorry, Miss Sarah. That's why we want to do the surgery and assess your fitness. Okay. Uh, do you have, Miss Sarah, any medical conditions that you see your GP for?
Yeah, I have asthma. Sometime I have its attack and I used to take a pump. And I also on and off have chest pain and for which I'm using a drug called aspirin.
Oh, okay. Okay, so let us take us one by one because this important information I want to take my time with it. Okay. Regarding your heart problem, you said you had a heart attack, right?
Yeah, I have
Okay.
sometimes chest pains, and I'm also
Chest pain.
diabetic. Yeah, I'm on some oral hypoglycemic drugs.
Okay. Okay. Do you have any blood pressure problem?
Yeah, I sometimes have blood pressure problem as well. I take medicine for that too.
Okay, you take medicine. Do you know what's the medicine you're taking?
I think it's called some captopril or something.
Okay. And do you visit your GP regularly about this?
Yeah, I see my GP for this.
Okay, that's good. Also, regarding the chest pain, when was the last time that happened for you?
Yeah, it happens twice, and since I'm taking medication and while I'm lying on bed, I have no problem. But if I try to go upstairs, I sometimes can have it. That's why I prefer staying on
Hmm.
bed.
Hmm. I'm really sorry for that, Miss Sarah. You seem really struggling. I feel for you. Okay. You said what medication you take for this chest pain? I'm sorry.
Aspirin.
Aspirin. Okay, that's great. Also, you said you have diabetes, right? Is it controlled? Are you on diet or are you on pills or are you on insulin?
Yeah, doctor, I try to control it. I try to restrict my sweet diet,
Okay.
my carbohydrates, but I cannot exercise. That's why my doctor says I have to do
Okay.
exercise, but this joint pain is killing me. I cannot exercise at all.
Okay, I'm so sorry for that, Miss Shara. Okay, and you see your GB regularly about this diabetes, right?
Yeah.
Okay. Do you have any cough or shortness of breathing?
No, I don't have any cough.
You don't have any cough. Okay. Do you have uh, some asthma or something?
Yeah, as I said, I have asthma and I take during if I have asthma attack, I can take a pump, an inhaler.
Okay. So you only on the bump. You don't use any steroid for it. Your GB wrote for you, right?
No, I don't use any.
I'm so sorry for the lot of question, Miss Sarah. Okay, just bear with me. Okay. Have you had any operation done before, Miss Sarah?
No.
Okay, that's great. Do you use any besides this medication? Is there any long-term medication you use?
Yeah, for my painkiller, I use a drug called diclofenac. for some time,
Okay.
but because of it, I get heartburns and I have to stop it as well.
Okay. Do you use any blood thinner, Miss Sarah?
No,
Okay. Okay. Are you do you have any sensitivity to any drug?
no, I don't have any.
Okay, that's great. Is there someone in your family have this same problem where they have long-term illnesses like the diabetes or the blood pressure problem or
Yeah,
the
my
just
father
your
have
father?
heart issues. That's why he passed away due to the heart problem.
I'm so sorry to hear about that. May he rest in peace, and I'm sure that worried you so much. I'm so sorry for that. Okay, Miss Sarah, I'm going to ask you some personal questions, okay? And what do you do for a living?
I'm a housewife.
Okay, and whom do you live with?
I live with my husband and son.
Okay, do you smoke?
No, I don't smoke.
Okay, do you drink alcohol?
Yeah,
Can you
sometimes.
please summarize your history now?
Okay, thank you, Miss Sarah. You have been so cooperative with me. I will take this information to my consultant and I will get back to you, okay? Okay, Miss Sarah is a middle-aged female, came to the preoperative assessment for a left total hip replacement. She has a background, which is the pain of her hip is getting severe, scores 10. She has a background of asthma, which is controlled by inhaler. She has 2 episodes of heart attack, which is now on aspirin for it. Also, she has blood pressure, which is an anti-hypertension. She is diabetic, but controlled with only diet. She has a family history of MI. So my recommendation will be after completing examination and uh, doing some investigation, doing like echo, ECG, measuring the INR, doing complete blood count, and doing chest X-ray.
Wait,
Also, okay.
what was your pre-assessment, preoperative assessment? What have you concluded?
Oh,
Should the patient's planned total hip replacement go ahead or not?
patient will not go to surgery because she has many comorbidities.
Yes, and the most important one is recurrent angina. Okay, so what investigations do you plan for her?
Okay, complete blood count, urea and electrolytes, and glucose level and hemoglobin A1C. Regarding imaging, I would like to do chest X-ray. Also, I would
Yes.
like to do ECG and echo.
Yes, echo. Very good. Okay, and in the view of chest pain,
Okay. I would like to do chest
refer the
pain.
patient for the cardiologist. And for
Yes.
asthma, also you want to want the lung specialist to have a look at the patient. And then what about the anticoagulants that the patient is taking?
Yes.
How would you take care of
Patients.
that?
Yes. Before surgery, we'll make sure patient bridging. We will stop the warfarin 5 days before surgery and put
Yes.
heparin and stop it also 12 hours before surgery.
Good.
Yes.
What about the physical examination? If it is concerning, what would you do?
I will order some investigation regarding what I found.
Yes, especially for the low limbs, like their atrial duplex or the
Yes,
spine.
yes,
Good.
yes.
Okay. Thank you.